they shock you? Are they able to shock you without scarring or making a heart beat more abnormal?
Okay, so Chris kind of brings up a good point and kind of goes along with what Zach was saying. Is kind of the way our heart works is we get input from the nervous system, right? And there's kind of a series of electrical activity that our heart has. The nervous system, you guys have had a little bit on your neurology course, yes? With nerves a little bit. And you know nerves kind of have like a series of electrical impulses. So these electrical impulses will kind of tell them.
No.
Click yes.
More info.
So when we were talking about like electrical activity with the nerves going to the heart, is when we use the kind of the cardiac arrest, you always see them like going clear and they'll pump the people with electricity. The kind of the same idea is it's kind of a way to kind of stimulate the heart. It can damage somebody, so somebody who's not in cardiac arrest, we're saying like the heart's not beating there's no electrical activity during cardiac arrest. So when you actually will shock somebody who is not in cardiac arrest, whose electricity is normal, you'll disrupt their electrical input, and that will kind of be not good, and that can damage the heart. That can actually throw somebody into cardiac arrest. So what's a heart murmur? So that's a great question. That actually goes with the question earlier. Okay. Alright, so this is going to be our video a little bit. I want you guys had great questions on kind of heart murmurs and heart pulls. I want you guys to hold those for a second because those are very good questions. Okay. You guys want to see kind of the 3D version of the heart here? Yes. Yes? I know you guys are trying to take it off. You want me to turn off the other light? Alright, that better? Thank you. Okay. Alright, so we're going to go ahead. This is showing kind of where the heart sits in the body, like I said. See this here? This is going to be our right atrium. So you see this right here? So what's this guy? So what's this flowing into our right atrium? So this is superior chamber. What's this guy? Nice. So it's going from the right atrium into the right ventricle. What's this thing? Valve. So which valve is it? Tricuspid. Awesome. So it's going to go through the tricuspid valve. You see how before the heart contracts, the valve closes. Right ventricle is contracting. You have the blood going through here into the pulmonary artery. So it's giving you a nice big close-up of the valve. It is going in slow motion. All right.
It's like one of those flowers.
It is. It's cool though. It's cool how it works. So we have the blood going from the right ventricle to the pulmonary artery. Isn't it going fast? All right. So now we're back into. We've been to the lungs. Now this is the pulmonary veins coming into the back of the heart here. The pulmonary veins are going into what's this chamber here? If it's the pulmonary veins.
Right atrium.
Left atrium. Nice. We have our left atrium. We have the left atrium is going into the left ventricle here. So what's that valve there? Bicuspid. Nice. Good. Does anybody remember the other name for the bicuspid? Mitral. Nice. So now we're going from the left ventricle into the body. Good. So left ventricle into the body, and what's this pumping into? The aorta. Nice. That was the key. Yay. Good. Right. All right. So did that kind of make sense? Did that 3D model kind of help to clear things up for you guys? A little bit. Yeah. There we go. I know. All right. Okay. That you guys, before we kind of do a quick kind of 10-minute Jeopardy, okay? And probably the best way to do it is we'll split the room in half, right? Okay. This side versus that side. That's cheating. Before we start Jeopardy, I had 2 questions that were really good that I want to kind of talk to you guys about really quickly, and then we'll get into Jeopardy. How's that sound? So, what were your guys' names? I didn't check. Khadijah? And And you are? Eric. So Khadijah asked, what happens if you have a hole in the heart? And Eric asked, what's a heart murmur? And these are great questions because you guys have probably heard of these things, right? So, kind of before you're born, remember I told you guys that we get our oxygen from mom, right? So we don't get them from the lungs. So what happens in baby is the baby will have holes in the heart to skip the lungs, right? Because the baby doesn't need to use its lungs if we're getting all the oxygen from mom, right? So the baby is going to have kind of some holes going on. Baby is going to have a hole between the right atrium and the left atrium, and that's called kind of something called the foramen ovale. It's actually kind of cool because in the right atrium there's a little remnant that's left over that's a little thinner called the fossa ovalis in normal adults, but people can actually have an open foramen ovale between the right atrium and the left atrium. If you're born and there's a big hole, somebody can have something called an atrial septal defect. There's like a big hole between both atrium, and that can give you a heart murmur. So like anytime you kind of have a hole in the heart, you can have something like a heart murmur because you have all this blood kind of rushing over in a place where it's not supposed to. Between the left ventricle and the right ventricle, you can also have a hole called the ventricle septal defect. The ventricle septal defect and atrial septal defect, those aren't normal holes, but the foramen ovale is a normal hole. So like babies, all babies should have an open foramen ovale between your atriums, but not all babies when you are born should have a hole between your ventricles or a hole, an atrial septal defect or a ventricle septal defect. Does that kind of make sense?
Yes.
So when you're born, you have something called an atrial septal defect or a ventricle septal defect, you'll have these holes here, and that's going to cause you to kind of have murmurs. One cause of murmurs. You can also have murmurs when, we were talking about how your valves can kind of get scarred and messed up over time. If you're going to have blood flowing and you're going to have kind of these scarred, messed up valves, it can also cause you to have a murmur and have kind of noises.
But if you're an adult with a hole in your heart, what is the cause of that?
If you have a what?
If you're an adult with a hole in your heart or a teenager.
So if you're an adult or a teenager, you can actually still have kind of the atrial septal defect or ventricle septal defect. You can have this as well. You can fix it, which is really awesome too. So you can actually do surgery to correct this, which is cool. All right, so we've got a little bit of time to do a quick Jeopardy. Does that sound good to you guys?
Yeah.
Yeah.
All right, hopefully we can kind of confirm what we've done so far, okay? All right, so we're going to have this side of the room. This side of the room. Okay. What did you say? All right, so.
Screen?
Wait. Okay. Any more questions though before I kind of set this up? Alright, so the way that Jeopardy is going to work is I've got 4 categories. We're going to have 4 questions each. And we're going to take turns with Jeopardy, so one side of the room can go and the other side of the room goes. If one side gets it wrong, the other side can steal the question. Okay? What'd you say? Alright, so this is going to be Team Awesome. What do you guys want?
Yeah, those taste
Team Awesome.
We're gonna be Team Ruffin.
No, we are. We are.
I don't care what's your name.
Alright, so Team Alright, so what you guys gotta give me names.
Team Ruffin. Unknown.
Team what?
Ruffin.
Unknown.
Team Ruffin?
No.
Disagree. Negative.
You guys gotta give me a name in 10 seconds.
Team Batman. It should be, yeah.
No name. No name.
So we have Team Awesome. We got
Team Awesome.
It's team.
It should be team name, not team name.
It's team not no name.
Alright, so we're gonna have 4. Alright, guys. We're gonna have 4 categories. So category 1 is going to be valves. 100, 200, 300, 400. We're going to have cardiovascular, or the circulation. Remember we went on the board and we talked about kind of body, arteries, cardiovascular. We're going to have cardiac anatomy. And then we're going to just have a kind of a miscellaneous catch-all, right? And we have, each category is going to have 4 questions, okay? So, team awesome. You guys go first.
We want cardiac anatomy for 400, please.
You want cardiac anatomy for 400?
Yeah.
All right.
Did you actually hear?
Cardiac anatomy.
Did you hear?
All right. What is the name of the hole between the atrium that you have for your board? Ooh, you did right. For your what?
Here's some. Can you repeat that?
Okay, I'll repeat the
You got it.
question.
You don't got it?
Do you guys, everybody get a question? So what is the name of the hole between the 2 atrium that you have on your board?
Is the Raymond Valley?
So Perimeter Valley, okay, that.
He definitely didn't say that.
I say Perimeter Valley here, right?
Yeah.
What's that, right? Perimeter Valley. Team, no name. Choose the category.
Team no name.
Valves for 400.
Valves for 400. I kind of told you guys this briefly. So why do the pulmonary and aortic valves close?
Okay.
Do you guys need me to repeat the question?
Be good. Challenge.
What is it? Stop the blood from?
Into the lungs or into
No, just.
Aging.
So I said that. So
Say the pulmonic and aortic.
pulmonic and aortic valves. So why?
The ventricles.
So why? Okay, so go. Say it again.
What is?
Stop the blood from going.
Nice. Good job. All right.
Badly.
So did everybody get that? The reason why we have the pulmonary aortic valves closing is we do not want the blood to flow back into the ventricles. All right. Good. Good job. All right. Team awesome. You want cardiac? I want you guys to give me 3 structures surrounding the heart. So 3 associated structures.
You want to say, what is the sternum?
Okay. Okay, good. Now for bonus points. I'll give you guys bonus points next round too, okay? You guys get bonus points in the next question. So for bonus points, can you guys tell me where those things are located?
The dark is right behind it, the pink thing on the back there.
Okay, good.
It has a trachea.